Commissioners. Our conversation brought to you by Marcus and Mack, a law firm representing injured people. I'll move this out of the way so our Facebook viewers can see Sherene. She was blocked there. We didn't want that, Sherene.
No.
All right, so let's get into our conversation this morning with our Indiana County Commissioners. Commissioner Keith not able to join us today, but Commissioners Gorman and Hess are with us. Ladies, who goes first?
Good morning.
Good
I'll let
morning.
Sherene, she's got a really important topic to talk
Okay,
to us
Sherene.
Well, yes, and we've all heard about it, and it's not the most exciting thing, but it is very important. It's about the census. The Census Bureau is undertaking its this mammoth task of tallying up all the people in the United States every 10 years. It happens. They look at increases and decreases and the changes in our communities, and that number, for better or for worse, goes to decide how many representatives you have in Congress. It also determines federal funding for programs like Medicare and Medicaid and the Children's Insurance Program and the school lunch program and many of our human services. So all that to say, please, when you get your form, go online or call or just answer those questions. We need you to do that, folks.
Do you want to hear the latest results from this week's poll question? At our website, WCC Great Far, leading the voting with 45% of the vote is it's very important because it affects federal funding and congressional representation in Washington. 45% say that. Next, with 24%, is I really don't care about it, but will participate because I'm legally required to. So that's 24%. 16% say I don't trust that the information will be kept confidential. Then 11% say it's a waste of time and an invasion of my privacy. And 4% say I don't care about it at all and I won't participate.
Okay,
So
we got to have a little work to do there.
Messaging. It's all messaging, isn't it, Sherene?
I mean, I just would say if you have any doubts about it, call somebody or read a little bit about it. It's really pretty innocuous. It's simple. It doesn't take long. And it is, I mean, as I say, for better or for worse, it's how we dole out those funds or how the federal government does. And we need every bit we can get here in our rural areas. And we know how to leverage it and get the most out of it, but we need it to come in here in the first place. So
Got to get everybody counted.
good poll.
Yeah.
Glad to, yay, Indiana County, at least a good 70% there or more got it doing their civic duty. Appreciate that.
We'll keep you up to date on what the end results are from that poll, which is not scientific, but it is certainly an indicator.
It is. Thank you.
And has been done for decades, right? So
Yeah.
if there's any
Every decade.
speculation, right, every decade. So it is used for what it is. That's proven itself. And like Sherene said, it's extremely, extremely important. So for you naysayers out there, come on.
Yeah.
And for
Help
those
us out.
for everybody watching on Facebook, she was wagging her finger
Help us
at that
out.
time.
Do your duty.
It's that important.
It is. It's extremely important. Simply to keep up with everybody else
Yeah.
around the region, Indiana County needs to be in there fighting for its share, and this is a way that everybody has a chance to do it.
Yes, agree.
Okay.
Thank you.
So what else are we talking about today?
Well, we've been busy, and obviously we're in our second month, Mr. Keith and I, and we are continuing to learn, continuing to meet with all of our county agencies, their directors, their teams, and getting in there with them. And just people have asked me, they're like, well, what's it like, Robin? Are you having fun? Is it everything you thought? And I said, yeah, and more. It's amazing. And when I say amazing, that doesn't mean that we're not hearing the good, the bad, and the ugly. I mean, we have to do that to get in the trenches with our people and to figure out the best solutions going forward for whatever our issues are. So by that, it has been amazing. And, I know we say it a lot here, Todd. We've heard our state representatives, Don White, Dave Reed, and now Joe Pittman and Jim Struzzi. And we've heard our collective community talk about how we're different. Indiana's different. And we've had the opportunity to attend some regional and some statewide conferences so far. And people will come up to me and they will say, can I talk to you about this or that? I'm not going to point out any one thing, but I can't believe how proud I am to be a county commissioner in Indiana County already, because they're talking about models that they want to replicate or things that we're doing right. As I get in and talk to our people, that's what it is. That's the special niche, is the people that go over and above and do it because they're passionate about it, not because they have to or it's a job. And by far, it does make us special, and it stands us aside in working together to get things done.
You, as a board of commissioners and as individual commissioners, you've had a chance to hear Governor Wolf's budget address, our lawmakers' responses to that budget address. Commissioners have to pay extra special attention to the budget, and Governor Wolf's address is the start of a process that is designed to conclude by June the 30th, at which time the counties then will have to react to what's coming in and what's not coming in. So from each of your individual perspectives, what was the budget address like for you?
Well, we started to react as an association right away. And in fact, mental health funding, the base funding, was one of the Commissioners Association's top priorities. And unfortunately, that the governor's budget proposed funding that was stayed at its level. But there are hearings happening, and we had, Commissioners Buston and Commissioners Arcouche from both a very metropolitan area and a very rural area go in and to this hearing and testify about how important increased funding is for our mental health programs. State funding has lagged for many years. We've never really reached to the point to where it was before. And meanwhile, the need has increased just exponentially. So it is a top priority for us in Indiana County as well. So we're hoping that some of those, advocacy efforts on the part of other commissioners and for us will help, because we really need it in Indiana County. We have a number of human services agencies that all work very well together on mental health and the drug issues, treatment and prevention, and any number of mental health and other human services. But we need the dollars too, so that's a very big priority for us.
I've long felt that we're sending the state plenty of money. It's in terms of the drug culture, in terms of the public safety concerns. Mental health touches almost every aspect of society.
Well, it does. I mean, it affects our workforce. It affects local economies. It's of course, it's very difficult for the families. Look at schools, and just at a time when funding was so low that psychologists were becoming, a thing of the past, and now I understand that may be changing, which is good. I think, and that was another thing that the commissioners studied was adverse childhood traumas and the effects that those carry through, into adulthood, and then at some point society deals with it. So, as you say, Commissioner Gorman, that we are a body that, and we have a voice, and that is what I think is so special about any elected official and the folks that work in public, as public servants. You have a voice to try to help people. That's why we got into this. So, important stuff.
All right, so the next month, 2 months, 3 months, 6 months, however far you want to project it, what are the county commissioners' priorities? What are you guys looking at?
Yeah, and we do need to continue to talk to our agencies to help work together to figure out what the priorities need to be as far as in order. But let me start with our statewide association, Todd, and you and Sherene, of course, talked about the number one that our CCAP organization put out there, and that's increased funding for mental health. So we do hope the lobbying efforts start to work on putting that lever up a little bit on that funding to address some of the issues that we've really got some good data points on that I think we can be helpful to. It's no secret in this community and across our state, but the solution to the emergency management crisis that's going on, our neighboring county, Cambria, and if you would, Westmoreland, if you will, they sort of sit in that little nook there. I don't know but it came out in the Laurel Valley or the New Florence Emergency Management Center closed, and then that had a rippling effect as to who was going to meet those needs of that community. So it is very important, and we've been talking with all of our emergency management providers. They assure us that is not going to happen here. And I trust that, but that doesn't mean there aren't issues we have to address with them. The third issue that our state put forward, of course, is the county tax reform. And that stands, we've said that, and we continue to work with our state legislators on where that sits right now in the legislature, and we will continue to work that issue for our community. Rural broadband, no secret, another issue, the number 4 priority for our state, and all of these align to Indiana County very well. In fact, this week, I think Friday, the commissioners and a couple of other people in our community, key servers, are going to meet with the state senator about broadband and what our efforts will be going forward there is a good plan. And then 5 is the adult probation funding, or you could wrap that into just the whole juvenile criminal justice system, and obviously having a jail that operates very well here in the county. All of those things that try and lead up to that, or more importantly, curtail and keep people out of jail, all the more important. So those align very well with our own community priorities. And again, we're just trying, like Sherene said, and you talked about mental health. Oddly, when I worked at the university, this was a growing issue, and we could see it for years in advance. And it's really the young people, like you said, whether it's school, whether it's college, in the higher ed, or those that are out in the workforce. It's real. And we need to pay attention to it and get ahead of it, and before it becomes a real more problem than it already is. And it's going to impact every area of our economy.
Yeah, absolutely. All right. County Commissioner Sherene Hess.
Hello.
Commissioner
and
Robin
thank you
Gorman.
all.
Thank you for being with us this morning.
Thanks for having us.
We appreciate it.
Likewise.
And
See
as-
you next time.
As always, brought to you by Marcus & Mack, a law firm representing injured people. It is the voice of Indiana County, WCCS AM 1160 and 101.1 FM.